Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, June the 8th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. There will be a briefing tomorrow here with Dr. Henry. And then on Wednesday, we'll have a written briefing. On Thursday, both of us will be back for a briefing then. And then on Friday, there'll be a further written briefing. That's our plan for the week. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So we're reporting on 3 days' worth of numbers today, starting with the Friday, Saturday, then Saturday, Sunday, and Sunday to today. So we had 14 new people test positive for COVID-19 on the Friday, Saturday, 6 new test positive cases between Saturday and Sunday, and another 9 new people test positive between yesterday and today. In addition, we have a single new epidemiologically linked case over the weekend. So that brings our total to 29 new people who have tested positive for COVID-19 plus 1 epi-linked case, bringing our total number of cases in BC to 2,659. That includes 907 people in the Vancouver Coastal Health Region, 1,362 in the Fraser Health Region, 130 in the Vancouver Island Health Region, 195 people in the Interior Health Region, and 64 people in Northern Health Region. You will notice that the totals are slightly off from if you count up the numbers between Friday and today, and that was due to a data correction where reconciliation of the numbers meant a decrease in Vancouver Coastal Health. We have no new healthcare related outbreaks, and 1 additional outbreak has now been declared over at the New Vista Society Long-Term Care and Fraser Health. That leaves us with 4 active outbreaks in the healthcare system, all of them in long-term care. We now have 558 cases associated with these healthcare outbreaks, including 340 residents and 218 staff. And over the weekend, we've had only a single additional case in a staff person and no new resident cases. We continue to have a number of community outbreaks that we're following that we announced last week, but on a positive note, the outbreaks at the Fraser Valley Specialty Poultry and at Superior Poultry have now been declared over. So that leaves us with 183 active cases in the province right now, of whom 16 are in hospital currently, 4 in critical condition or ICU. On another very positive note, we have had no additional deaths over the weekend. That leaves 2,309 people who are now fully recovered from COVID-19. As we continue to slowly and thoughtfully ease restrictions, things like campgrounds now open, we're now looking at, many of us are making plans for summer travel, and we know that the school year will officially end in the next couple of weeks. And like other activities during our COVID-19 pandemic, summer holidays and travel will be different this year. And I'm encouraging all of us to be respectful of the communities that we plan to visit and to be safe as we enjoy the many beautiful locations that we have here in British Columbia. Remember that when you hit the open roads this summer, you aren't leaving COVID-19 behind. We need to be aware of where we are going, whether it's a larger community or a smaller community. We need to, before we go, contact the local tourism association or the Chamber of Commerce and find out what services are available and what may still be closed. Get a sense of what you need to take with you so that you're not putting an undue burden, particularly on a small community. We need to be as self-sufficient as possible so that we don't put these burdens on our communities. And we need to remember that the precautions that we take at home should also be taken when we travel. In particular, if you are ill or someone in your family is not well, don't go. If you are already traveling and become ill, you need to isolate and stay away from others, same as we do at home. No matter where you are, we need to continue to follow the rules that we've all learned for social interactions. So that means few faces, larger spaces, maintaining our safe distance, cleaning our hands regularly, and always staying home if we're ill. Like all of us, BC's communities are doing what's best for them as well, and some towns and regions who rely on tourism are eager to get us all back there to welcome BC residents and Canadians with safety measures in place. Other communities are challenged to support large numbers of people coming in and are asking visitors to be mindful and to keep their stays short. By understanding, be understanding of those in whose communities you may be going to and who may be coming to your community. We can't assume that we understand everybody's story. A visitor may be traveling for work, may be traveling to support a friend or a family member. Our circumstances are unique, but our efforts to keep our loved ones and our communities safe are things that we share together. No matter where you may be this summer, we must all continue to minimize, to manage, and to modify. That means doing all we can to minimize the number of new cases and the transmission of COVID-19, helping public health to manage cases and clusters with rapid contact tracing by keeping our household bubbles, by keeping our contacts small, modifying our actions and measures as we need to keep our communities and our families and our province safe. We can all enjoy this summer and do it safely. We can protect our province by protecting each other while showing the kindness and compassion and respect that has gotten us this far. What you do today does make a difference and will make a difference in the coming weeks and months. So please continue to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. I wanted to acknowledge it's very good news over 3 days this weekend from Friday to Saturday, Saturday to Sunday, Sunday to Monday. No one passed away from COVID-19, but all of those who have passed away from the beginning of this pandemic and its impact on BC remain in our thoughts and in our hearts today. And we're just grateful, very grateful that no one has joined them this weekend, which is a positive sign and something that's always worthy of celebration. As Dr. Henry has said, the number of people in acute care hospitals with COVID-19 has been reduced again to 16. That's 6 in Fraser Health and 10 in Vancouver Coastal Health, and no one in acute care hospitals in the remaining health authorities. Again, this shows a significant reduction, as is the reduction by 1 in critical care, and indicates overall, I think, a flattening of the curve in the province. I'm also very grateful as someone who knows the New Vista Society and facility well, that the outbreak has been declared over there, and 2 other outbreaks in the poultry industry have also at Superior Poultry, Fraser Valley Poultry have been declared over. This is good news in terms of dealing with the pandemic. As I won't be here tomorrow, I wanted to give you a regular weekly update on PPE. As with previous weeks, I'll report on how much PPE has arrived cumulatively since the beginning of April, and then specifically what has arrived over the last week. To recap our cumulative totals to last week's report on June 2nd, BC has arrived. The following PPE has arrived in BC. Just over 4,800,000 N95 or equivalent respirators, over 5 million surgical masks, close to 2 million pieces of eye protection, including goggles and face shields, over 30 million pairs of gloves, over 2 million gowns, and many of these items I've just listed are in our testing process to make sure products meet or exceed safety requirements before being used in BC's healthcare system. Today I can tell you that over the last week, since my update last week on June 2nd until today, we've received the following: 666,240 N95 or equivalent respirators, 4,054,000 surgical or procedure masks, 189,871 pieces of eye protection, 12,765,400 pairs of gloves, and 221,000 gallons. I also wanted to note and express my appreciation. 636,000 of the masks, of the 4 million masks, are from the federal government's bulk procurement, and we're very appreciative of that. I wanted to also just note that the situation in BC, the 29 cases and the 1 EpiLink case we've seen over the last 3 days continues to see a relative flattening of the curve, and certainly the news with respect to hospitalization and critical care shows that. But the challenge around the world with COVID-19 continues to be profound, including involving many of our neighbors. As you'll be aware, we've seen a significant increase in the 5-year average of caseload in Washington State over the last week, from just over 200 to just over 300 cases. In Oregon over the last week, where it's more than doubled from a lower level, from around 30 to over 60. In California, it has gone up significantly as well. And in Arizona, the case rates have spiked dramatically, such that they're almost 3 times as much this week under the 5-day rolling average as they were last week in all of those states. In other words, the states closest to us, the states where people are most likely to visit from here, states with which, such as Arizona, with which British Columbians often have a strong connection, are all seeing significant increases. This is why we continue to have to be vigilant, particularly at the border, in ensuring that we keep transmission low. And we are going to continue to act in concert with the federal government to do that. And it becomes important, even as we make efforts to allow some families to reunite. We have to continue to be vigilant on the question of visitors at this time, where unfortunately our friends in the United States, all of whom are working very, very hard to address COVID-19, all of those states are within their jurisdiction, nonetheless are dealing with a very difficult situation, and one that represents a challenge for all of us. And I just want to say in closing, on top of that, just to express again my appreciation to people in British Columbia for all they're doing. The week marks the start of week 4 of our social, surgical, and economic renewal. In a week's time, we'll complete the 2nd incubation period since the easing of restrictions began on May 19. This pandemic has forced us to change our practices, our routines, and our way of thinking about how we interact with each other to keep everyone safe. But our duty to protect the vulnerable amongst us, our elders and those who, because of underlying conditions, are most susceptible to COVID-19. Continuing to support each other by staying 100% committed to what Dr. Henry and public health leaders have taught us will continue to see us overcome challenges today, tomorrow, and in the weeks and the months to come. En français, aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle de 5 et 6 juin, celle de 6 et 7 juin et celle du 7 jusqu'au 8 juin en mi-journée. Il n'y a eu aucun nouveau décès liés au COVID-19 durant ces 3 périodes de référence, pour un total de 167 décès en Colombie-Britannique. Nous continuons d'offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Pour la première fois, période de référence qui s'étend jusqu'au 6 juin, nous avons eu 14 nouveaux cas. Pour la deuxième période de référence qui s'étend jusqu'au 7 juin, nous avons eu 6 nouveaux cas. Au cours des dernières 24 heures, 9 nouveaux cas se sont ajoutés. Cela représente 30 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 2659 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 16 personnes sont actuellement hospitalisées, dont 4 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you. We're just going to have Bonnie repeat a little bit.
I've been asked to talk, just to sum up again. I understand the feed went black. So my last part of what we were talking about was just reminding people that no matter where we may be this summer, we must all continue to do our part to minimize the number of cases, and that means making sure that we keep our connections small in number, that we don't expand our contacts and that we help public health to manage cases and clusters with rapid contact tracing by making sure we know who we're with and we can connect with them, and modifying our actions and measures as needed. We can all enjoy this summer safely, but we need to protect our province by continuing to do what we have been doing, showing kindness, compassion, and respect. What you do today makes a difference. It makes a difference today, and it makes a difference tomorrow. So let's please continue to be kind, to be calm, and to be safe.
Thank you. As a reminder to everybody on the phone line, please press *1 to enter the queue. You are limited to one question only. I would also ask that you please take your phones off mute. You will not be audible until I call your name. First question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Health Minister Dix. My question today is going back to something that you've been asked about before, but I understand now that some health authorities have plans to safely loosen visiting restrictions for families in long-term care, and wondering if you have any update on how soon arrangements can be made province-wide for people to see loved ones in seniors' homes, especially those facilities without any outbreaks at all.
Yeah, so that is something we are doing province-wide, and each of the health authorities is working with each facility, and the guidance is under development, as we've said, so we do expect that will be in place in the coming weeks.
Next question is from Richard Zisman, Global News.
Dr. Henry, I know with your closing remarks there you were speaking about travel. Can you provide some clarity around when we may see the time frame around the next phase and what the guidance from the province may look like in terms of re-engaging travel through British Columbia?
Yeah, so as we've talked about before, we've been measuring this and watching how we progress in incubation periods. So we are now in week 3, so the second incubation period. And if things continue the way we're seeing, by the end of this incubation period, we should be in a good place to start moving into the next phase. But of course, much depends on what we see day to day. So I cannot give you an exact day because we know we did quite a few things last week, including starting schools up again, including, there was some gatherings that happened. So we need to understand the impact of those. And we are still seeing cases transmitted in our communities. So we are moving slowly. And what we will be looking at, though, is how can we make best advantage of what we have in the summer to do it safely so that communities who rely on tourism are able to have people come and visit and do it in a way that doesn't overwhelm their capacity. And I know they're working on these things now. People are looking at those ideas. We've been talking about how best to do it. But it really is about checking ahead, finding out what's available. If you're going to a smaller community, be self-sufficient. Bring what you need with you. Same for camping, making sure that you have what you need and that you can take the precautions that you need, particularly if somebody becomes ill. We know, as we've talked about, that when this virus is anywhere, we're at risk, all of us, collectively. So when we are traveling, when we are moving, we're moving from areas where risk may be different, and we need to be mindful of that and continue to use the safe social distancing practices, social and physical distancing practices that we've all been doing for the last few months.
Next question is from Mike Potestio, Kamloops This Week.
Yeah, hi. My question is for Minister Dix. Wanted to talk about the resumption of scheduled surgeries, particularly at Royal Inland Hospital. If you could give us an idea of how many since May 19th have been completed at that hospital, what that hospital's pre-COVID-19 wait list was at, and what its current bed occupancy rate is right now, and then maybe finally just where are we in terms of across the system kind of ramping up to 100% capacity.
Well, as I reported last Thursday, and I'm happy to provide that information to you, we were up in the immediate work week prior to last Thursday to about 5,100 surgeries system-wide, which was a very significant increase week to week. It had been, I think, approximately 3,800 the previous week. And then during the period of the high period of the pandemic in the early part of April, it had simply been urgent scheduled and emergent surgeries, which was a significant number, but but well below that in the 2,000 range. So, and so that's been the circumstances. It's risen considerably. In terms of bed occupancy across interior health, it's actually relatively high right now compared to other jurisdictions. It's about 85%, which shows the system responding. It's equally high in terms of Vancouver Island Health. So we're seeing real progress. Just to put it in context, a normal rate of number of surgeries is about 6,000. So arriving at 5,100 in such a short period of time is a significant achievement. I expect that continued to continue to advance and increase the number of surgeries. We're aiming to get back to about 100% of previous capacity around the middle of June. And on the details of the number, we'll be updating again on Thursday, Health Authority by Health Authority. So you'll have the up-to-date numbers every Thursday, and I can forward to you last Thursday's numbers.
Patrick Johnston, Post Media.
Yeah, hi. It was interesting looking at the data last week and realizing what a vector the Pacific Dental Conference was for the outbreak. That same weekend, the Rugby Sevens were on at BC Place. And I'm wondering if we have any sense of why that ended up being not an outbreak factor. I know that, going into it, it had been approved to take place, whereas the dental conference, I remember, was not supposed to take place. And I remember some frustration about it having happened afterwards. What can you say about how that tournament perhaps differed in its crowd and other things?
Yeah, so at that point in time, you may recall we didn't have restrictions on gatherings in place, but what we did have was a risk assessment process for every event that looked at, who were the people that were coming, where were they coming from, where had they been before they came here, what was the type of situation, was it indoors, was it outdoors, was it in a large stadium, was it in small conference rooms? So it was a very detailed process that we were going through with each of the events. So that risk assessment, I was well aware of the one that had been done for the Rugby Sevens. They're done at a local level with the regional health authorities, with the municipalities. And we felt that the Rugby Sevens was not a high-risk event given the clientele, the people who were going to be attending, so the teams and where they had been and what they had been doing prior to arriving. So there was a lot of events that were happening around the province around that period of time where this type of assessment was done. The large number of people who came to the conference, including many thousands of people from other countries where we now recognize there was quite a lot of transmission happening, would have made that a riskier environment, as well as it was indoors in a conference center where there was a lot of opportunity for people to gather and do the things that they do and network at those types of conferences. So it was a time frame when we didn't have prohibitions on people gathering in numbers, but it certainly was something that sparked the importance of making sure that we don't have large numbers of people gathering together when this virus is still in our communities. And that is one of the reasons why we have continued to have the order in place around gatherings over 50. It's not a magic number, as I've said, and it is actually quite, we've been talking across the country, and 50 is highest of all of the provinces in the country right now in terms of gatherings. So it is in keeping with what people are doing around the world. We're trying to find ways of making sure we have some consistency in how we're doing things. And there's some good evidence that has recently come out that maintaining those distances and having smaller numbers of people is an effective strategy for preventing transmission. This is not meant to be punitive. It's meant to create the environment that allows us to be safe and have the social interactions with each other and ensure that we can manage the safe distances between us and that we're not potentially exposing a large number of people to the virus, now that we know it can possibly be transmitted when people have very mild symptoms or may not recognize that they're ill. And we continue to see that as a challenge here in BC and elsewhere in the country, where we see clusters of cases at workplaces when people go back into the workplace. Or we've seen it as well here in BC recently with large family gatherings where there was transmission between people. So those are the things that we need to take with us. And as we moved into the next phase and as we get adjusted to our new normal with this virus still with us.
Next question is from Dan Burrett, CBC.
Dr. Henry, this is for you. First of all, the City of Vancouver Advisory Committee is calling for the collection of socio-demographic and race-based data to understand the impacts of COVID-19 on racialized communities. Do you support that? If not, if so, why not? And perhaps Minister Dix could comment en français. Thank you.
Yes, absolutely. And this is something that we've been looking at from the beginning. We did not have that as part of our initial case report form across the country, but we have used some proxies in terms of looking at neighborhoods. But most importantly, the survey that we did very recently, over 260,000 people in British Columbia responded to it. It very specifically asked about those types of questions. We know that race is a learned concept and that it is something that we ascribe to people based on physical characteristics. And it is important for us to understand the impact of this pandemic, as we know many other pandemics and other health issues differentially affect people who are racialized in racialized communities. We also know that socioeconomic status has an important role to play in people's access and their health in general. So the survey that we did very specifically looks at those so that we can understand the unintended consequences and the impacts on different communities. As well, we're doing quite a bit of research at understanding, and we have a framework that we're looking at understanding the unintended consequences, both positive and negative, of the virus itself, but also the measures that we've put in place. And that is work that's being led by my office and the BC CDC. And we will also be looking at, ethnicity, socioeconomic status, neighborhoods, etc. I will say the one group that we have from the very beginning put a special emphasis on trying to understand the impact is on our Indigenous communities in British Columbia, and we have a partnership with the First Nations Health Authority as well as Métis Nation BC to understand those impacts as well.
Oui, comme vous avez sans doute constaté, on a fait un sondage. C'était, je pense, entre 300 000 et 400 000 personnes qui ont répondu, et on va pouvoir reconnaître cette analyse là-dedans. On a demandé cette question à tout le monde qui y a participé. Je pense qu'on va avoir des résultats importants là-dedans. Donc, on a fait cela. Bien entendu, je m'intéresse toujours à ce qui fait le Conseil à Vancouver. On est en train de voir et d'analyser toutes les caractéristiques importantes dans cette pandémie. Il faut forcer et de reconnaître que c'est surtout des personnes de troisième âge qui étaient victimes, qui constituent la grande majorité de nos morts. Et ça, c'est évident dès le commencement. C'est ceux qui vivent dans nos maisons aux soins de long terme, qui sont bien entendu malheureusement, on paye un gros prix pour cette pandémie. Donc, on a fait cela un peu partout. Je pense que c'est important. Mais ce qui est donc, on va continuer à faire le travail qu'il faut. Je sais que tout le monde aime avoir des chiffres, et ces chiffres sont importants. Mais cette analyse est en train d'être faite par le BC Center for Disease Control et d'autres, et on va le partager avec tout le monde, comme on a fait depuis le commencement. Nous étions le premier à partager nos analyses, nos projections pour l'avenir, et on va continuer à partager tous les renseignements nécessaires à qui que ce soit, y compris le Conseil à Vancouver.
Next question is from Lisa Cordesco, CHLY.
Good afternoon, Dr. Henry. I just wanted to ask a little bit about the case counts today. Doing the math, it looks like there's 27 new cases in Fraser Health. I just wondered where the other 2 cases are, or if I'd missed something, and what you might be able to tell us about these new cases. They're not associated with any ongoing community outbreaks, so are they all single random cases in the community, or are they from opening of restaurants or church gatherings? What can you tell us about that?
Yeah, so the majority of the new cases, as you said, are in Fraser Health, and they are they're all linked in various ways to known outbreaks. One of them being one of the long-term care facilities, but also to a cluster that I've mentioned, a number of with a family gathering where there was unfortunately transmission in a fairly large number of people in a couple of family gatherings. So yes, there's no unlinked cases that we've had recently. They've all been able to be traced back to either ongoing outbreaks or clusters that we have recognized in the community. And it just really speaks to sometimes we don't recognize that our contacts, and we're contacts, and then we're contacts with their contacts as well, and things can be transmitted, and those chains can go on for some time if we're not careful. And it goes back to, again, why it is so important for us to continue our measures of making sure that we keep our gatherings small, that we don't expose potentially larger numbers of people, that we are very cognizant of our safe distances from each other, and the importance of making sure we maintain those as best we can, of hand hygiene, of staying away from others if we're feeling unwell, and being very, very conscious of monitoring ourselves for symptoms on a daily basis. If we're going to work, if we're an essential worker who's going back and forth to the United States, for example, or if we're going to school, those are really important things that we must continue right now.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. BC Ferries just announced that passengers over the age of 2 will be required to use face masks while on board. I know you've talked about this before, but given the changing narrative about the use of face masks in Canada, do you anticipate revising your stance and issuing an order requiring people to wear them in other close proximity situations?
No, I don't intend to issue an order for wearing masks, and as you're aware, part of the requirements that BC Ferries has is related to Transport Canada requirements, and that's where that has come from. It is very challenging. Recently the WHO has updated their recommendations around wearing of non-medical masks in the community, and our approach has been very similar to what they say. There are very important and good reasons why people cannot wear a medical mask or a non-medical mask in the community, and we certainly don't want to put it on anybody who's not able to remove it themselves, because that can be dangerous. And so that's why we say we absolutely not recommend it for children under the age of 2. So there are also people with certain disabilities that make it impossible for them to wear a non-medical mask, or medical conditions that make it a challenge. So we know the things that work to prevent transmission of this virus are to maintain our safe distances. For those short periods of time where you can't consistently maintain those distances, then a face covering, a cloth face covering, is something that can help keep your droplets in. So it's what I do to keep my droplets in, and so that they aren't spreading into the environment, or it's what I do to protect you. So if all of us are doing that in those rare times when we must be within each other's safe space, that can help prevent transmission.
Next question is from Lisa Euston, News 1130.
Minister and Dr. Henry, Minister Dix, you talked a bit about the border earlier, but with the federal government now allowing this flexibility for family reunification, and some people chomping at the bit to have more flexibility themselves, what is your stance, and what do you see as far as the border opening up more broadly? You mentioned these increasing cases. Will this happen at any point this summer? And if I can just sneak one extra one at the end, Dr. Henry, when it comes to care homes, are you foreseeing this change in allowing visitations across the province coming by next week with phase 3, or will it take longer for health authorities to work out?
With regards to long-term care homes, health authorities and the care homes themselves are trying to work this out as quickly as possible. We know that there's still transmission in some of our communities. We've had another case in the north. We've had cases in Vancouver Coastal. So we do need to continue to be wary. The other thing that we know is that the situation is different for different care homes, and their situation about staff and how many staff they have, and the extra burden that having more people in the building can put in on staff and on the residents. And we need to take that all into account, which is not to say that we recognize the importance of family caregivers in long-term care. So it will happen as soon as we have a way to do it safely for everybody. And I can't give you a specific date, but it is something we have been actively working on for some time, and each home needs to make arrangements for it to be done safely within their environment. And that's some of the complexity. In terms of the border, we have been saying that it is important to allow families who have been separated across the border, but that doesn't mean that that people are allowed to come in without the restrictions that we have in place. And so we have not lifted our order on requiring people to be in quarantine or to self-isolation for 14 days after they come in from the United States. And the federal quarantine order still applies to anybody who comes in on family reunification as well. And that is the way that we protect ourselves and people who are coming to be with their family. The last thing they want is to bring this virus in and to affect those people that they are closest to, which are their loved ones, the people they're living with. So it is a way we can do this that supports people to get back together and to do it safely.
I think just to say what I said before, which is that in Washington, in Oregon, in California, in Arizona, in Nevada, states where there is many reciprocal relationships or where people from British Columbia go frequently, there are significant upticks, actual upticks in the month of June in the case counts for COVID-19, and that's a significant situation that continues to be a problem for us. In terms of reopening, the general reopening or the reopening of borders to visitors anytime soon. And I don't see that as practical. I don't see it as practical either to have Canadians visiting and then coming back to the United States and then back. I don't see it as practical for people visiting from the United States. Obviously, this is federal jurisdiction, but obviously we in the province are spending enormous effort and resources, everybody. And we can all think, every single person watching us can talk about the efforts they've made over the last number of months to reduce the transmission of COVID-19. And we have to, for those reasons, be significantly, especially in this moment, especially vigilant around these questions. Unfortunately, and this is not something we take we're anything but sad about. In fact, the significant increases we see in states like Arizona are profound for those communities. The significant increases, even if they're from 200 to 300 a day on a rolling average in Washington State, they're profound for people. People are our friends, our neighbors, the people we're very close to, are struggling with this. And so this is not something that we see as desirable or anything else, but it is something that I see as necessary in the coming period. Absolutely, for sure. We have made, and the federal government has made, provisions for people whose families have been separated. They're a specific group of individuals and class of individuals, and even there, the rules have to apply in terms of self-isolation on return to Canada or on arrival in Canada. I think those are important things. As you said, with respect to, as Dr. Henry said, with respect to seniors care, I just say this, that there are province-wide policy that Dr. Henry has signed off on, the Ministry of Health signed off in respect to visits. And so from the beginning, again, this has been a real sacrifice for a lot of individuals, but of importance nonetheless. We have, as everybody knows, one care home in the last half of May that suffered a significant number of deaths. And so that tells us the vulnerability of people in care. So all of that is going to have to be taken with great care and with great prudence, and it's going to involve Dr. Henry, the provincial health officer, the medical health officers, the Minister of Health, and the health authorities. We're obviously hearing from people in the community, but as well, it's absolutely necessary to ensure that to continue to ensure that people in long-term care are safe.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. I'm hesitant to ask a question based on stuff that's suddenly appearing on the internet, but all over Twitter is people saying it's your birthday today. If that's the case, on behalf of everybody watching and listening, happy birthday. But my question is about your point about family gatherings leading to an outbreak. How concerned are you that what we've seen with large protest rallies are large gatherings where a lot of people are wearing masks, but a lot of people aren't. A lot of people are social distancing, but a lot of people aren't. Are you concerned that we may see a spike in cases as a result of that, similar to the family gathering situation?
So to the first question, no, it's not my birthday, so I'm not sure where that came from, but thank you for the good wishes anyway. Yeah, you know, it's a very difficult thing because we know that people need to speak up against racism and against the impacts that it's having on our communities. But I am concerned, and we are concerned, that we need to make sure that we're doing it in a way that respects peaceful demonstration, our right to peaceful demonstration, but also respects that we cannot have impacts, that potentially we can have impacts on those very people that we are trying to stand up to protect. We know that Indigenous communities are more differentially affected by this pandemic and by all pandemics. We know that we have seen that many racialized communities are also adversely affected disproportionately. So we need to be mindful, and you know, my recommendations to people are to obey what we have in place, and you can have a profound impact by having many small groups. By wearing masks, by maintaining those physical distances. And we have seen that around the world, that they can be incredibly impactful demonstrations. I am very thankful that all of the ones we've had here in BC have been peaceful. But, you know, I implore people to make sure that you're not going to bring this back to your families and your loved ones and your communities. And we need to be careful about that. Right now, and for those who have been participating in these large groups, you know, that especially if there's a lot of chanting and you're close together, those are risky, and you need to monitor yourself for symptoms. And if you have any concerns about symptoms, to please get tested and connect with your healthcare provider in public health. Call 811. Take our COVID assessment, symptom assessment tool. You know, we do not want to have outbreaks seeded because of these very important ways of having our voices heard.
That's all the time we have today. Thank you.